All right, thank you, gentlemen. Follow from the panel.
I have a follow-up.
Ashley's got a follow.
Speaking of affordable health care, and you touched on the Affordable Care Act, once that's implemented, it's likely that a lot more people will qualify for Medicaid. And there are some medical societies throughout the state that estimate it'll go 1 in 3 people by the year 2020. How do you propose that we sustain this system? You have physicians now who aren't really privy to see Medicaid patients because they say their reimbursement rates aren't high enough. How do you make sure the state's healthcare system doesn't collapse from inside down?
Well, one thing we need, I'm sorry.
Okay.
Is that me?
I think it goes to Dave first, then Pat, 1 minute each, please.
Okay. I think what we need to remember is that the whole theory of the Affordable Care Act is that when we begin to put everybody into a system so that they have health care coverage, that you are able to reduce the overall price because you're not shifting costs constantly. We have to remember that we have plenty of money in the system in Illinois. We spend probably $90 billion of money in this state every year on both private and public health care. So the question is, how do we rearrange that? Yes, we'll be putting more people on Medicaid because they'll open up the rolls, and people who are ineligible today are going to be eligible in the future after 2014. But we also have to remember that there's going to be, through the health insurance exchanges, opportunities for people on a sliding scale, if they need to be able to buy into a policy. And it's important for small businesses that they have that opportunity as well. It makes a big difference in the system if all of a sudden you have people that are actually paying the bill. And that's what the whole purpose of the plan is.
Pat, you got a minute?
Yeah.
Got 2, I'm sorry. You got
Okay.
2? He's got 2.
Okay.
He's got 1. Yes, thank you.
No.
I've been corrected.
Who's counting?
Shake the dice here. Okay, just talk. It won't take me long. No, we need the buy-in. But you're going to dump in a system that's already broken, Medicaid. It's broken. We can't afford it now. That's one of our biggest things that are dragging down our budgets. How can we dump more people on that? Now, I don't want to cut anything. I grew up in a family where we had to stand in lines for those shots, but we worked our way out of it. But we have to have buy-ins, of course. But if we dump more people, there's 21% of the people in Illinois that are on Medicaid now. What's that going to drive it up to? We can't afford that. So we have to find a way to make sure that they get in a system, they buy in, they pay in, and the doctors get paid, the hospitals get paid. We have to make sure that happens.
All right.